What does drinking urine have to do with the diagnosis of diabetes? And is there a relationship between thyroid disorders and Alzheimer's? Let's find out. What are the organs of the endocrine system? And where are they?
Your endocrine system includes the pineal gland, hypothalamus, pituitary and thyroid, parathyroid, the thymus, adrenal glands, and the pancreas. But in this episode, we won't be discussing the pineal gland, hypothalamus, or pituitary gland. The endocrine system also includes ovaries, testes, neurohypophysis, adenohypophysis, and other things too that we won't be covering today.
In the early days of medicine, believe it or not, doctors actually had to drink urine to test someone for diabetes. Fortunately for them, today they have slightly more sophisticated methods.
The term mellitus and diabetes mellitus actually comes from the Latin word for honey. It was coined by English physician Thomas Willis, who diagnosed diabetes in his patients by drinking their urine. He described it as wonderfully sweet, as if it were imbued with honey or sugar.
The way the endocrine system works is that it produces hormones. Hormones are chemical messengers that surge through your bloodstream.
You can actually buy a glucometer for less than $10. You prick your finger and insert a small blood sample into the device. If it's more than 126 milligrams per deciliter on 2 occasions, you have diabetes. The pancreas, located behind the stomach, produces the hormones insulin and glucagon. There are 2 kinds of diabetes. People with type 1 diabetes are incapable of producing insulin. People with type 2 diabetes have cells that have a reduced sensitivity to insulin. The hormone insulin lowers your blood sugar, while the hormone glucagon raises your blood sugar.
Medical research has shown that there is a link between thyroid disorders and Alzheimer's disease. However, at this time, they're not sure which causes which.
The thyroid gland is located just below the Adam's apple. It's a bow tie-shaped organ that produces 3 hormones: thyroxine, triiodothyronine, and calcitonin. Calcitonin regulates calcium levels in the blood. It inhibits loss of calcium from bone. Although normal calcium levels increase slightly during puberty, throughout most of childhood and adulthood, an average amount of blood calcium level is considered to be 9 milligrams per deciliter. Thyroxine and triiodothyronine are known as the thyroid hormones. They stimulate your metabolic rate. If you have too little, it's known as hypothyroidism, and that leads to obesity and fatigue. If you have too much, it's known as hyperthyroidism, and that leads to weight loss and nervousness. Graves' disease is an example of hyperthyroidism. Almost 2% of women in the United States have it. Symptoms include thyrotoxicosis, exophthalmos, in rare cases, pretibial myxedema. Other symptoms include profuse sweating, irritability, high blood pressure, heart palpitations, and hair loss. The parathyroid glands are 4 small glands attached to the thyroid gland. They produce PTH, or parathyroid hormone. It stimulates the release of calcium from bone. It protects you from hypocalcemia. If your calcium gets too low, it can result in severe muscle spasms. It also helps your body produce vitamin D. One of the symptoms of hypocalcemia is known as Trousseau's sign. It's a spasm of the wrist and hand, and it's extremely painful.
Runner's high comes from the adrenal glands releasing epinephrine into the body. It's the body's natural painkiller. The brains of people who experience this are very similar biochemically to people who have just fallen in love.
The adrenal glands sit on top of your kidneys. They produce the hormones adrenaline, noradrenaline, cortisol, and aldosterone. Epinephrine and norepinephrine prepare your body for the fight or flight response. They raise your heart rate, your blood pressure, your metabolic rate, and dilate your blood vessels. Cortisol helps your body to maintain glucose homeostasis, while aldosterone helps your body to regulate mineral balance. Cushing's syndrome is caused by abnormally high levels of cortisol in the body. The main cause is overuse of corticosteroid medications, such as prednisone. One of the symptoms is that deposits of fatty tissue develop, such as the buffalo hump or moon face. Goodbye.